chronic disease and can potentially lead to blindness if it is not detected early enough. When glaucoma happens or starts off, then it doesn't have any symptoms in its typical presentation. So that is why it is important for everybody over the age of 40 to see the optician regularly, because that's one way where regular eye examination can detect if the pressure within the eye is high enough, which is one of the ways that it can be detected. So if the pressure is high within the eye and it is not treated or lowered, then the high pressure can cause damage to the optic nerve, which transmits the signals from the eye to the brain. And if the optic nerve is affected by the high pressure, then it stops working, and that is how it leads to blindness. This worsening of the health of the optic nerve from the high pressure is a one-way street. It is irreversible. So if somebody is detected when half of the optic nerve has already been destroyed, then we can treat and lower the pressure and control the condition, but the field defects that have already happened because half of the optic nerve is not working cannot be restored. However, it is still important for treatment to go ahead because the rest of the visual fields can then be saved. The way in which glaucoma can be detected is by, number 1, checking the intraocular pressure. Number 2, by examining the visual fields, the extent of damage or whether the fields are intact, and that is also done by the practice of the high street optometrists. And also examination of the back of the eye to look at the optic disc, which is the front part of the optic nerve, and if there is any damage typical of glaucoma, then that is another way to identify if the disease is starting off. Glaucoma also can have different atypical forms. This most common type of glaucoma does not have any symptom. It is only by checking that we can identify if the disease is starting off. There are other types which are less common, and there is a type of glaucoma which can present acutely and with symptoms like pain and headache and red eye, where the pressure goes high all of a sudden, and that is called acute angle closure glaucoma. The most typical one that I described is called open angle glaucoma. So when there is angle closure glaucoma, it is a medical emergency. It is an emergency because if the pressure is not lowered within an hour or so, it can lead to permanent damage to the optic nerve and blindness. There is a way we can identify by regular examination to see if the eye is at risk of potential acute angle closure. And that is by looking at the front part of the eye and doing an examination called gonioscopy, which looks at the angle of the anterior chamber. If there is a narrow anterior chamber angle which is potentially at risk of angle closure, then a preventive laser treatment called laser iridotomy can create a small opening within the iris which acts potentially like a safety valve, so that if the angle does go into closure and the pressure is rising, it can only rise so much, and then the water will flow from the posterior to the anterior chamber, preventing a block, and the pressure will never go that high to lead to a full-blown angle closure. So if we do identify patients who are at risk of angle closure, we recommend them to have what is called a laser iridotomy, and that is potentially a preventive measure to prevent angle closure. There are other various types of glaucoma, like congenital glaucoma, which can be present at birth. Sometimes, very sadly, they have already damaged the optic nerve and there is blindness right from birth or from a very early age. There are other secondary types of glaucoma which can lead from other conditions to present with a high intraocular pressure, like inflammation within the eye, steroid treatment for a long time, trauma to the eye, and various other conditions. If the pressure within the eye is not controlled in time, then it can also lead to irreversible blindness.